Welcome to Mr. Chalk's revision tips. In this video we will look at penicillin, aspirin, pharmacogenetics and synthetic biology. New drugs to treat people are constantly being developed. This is necessarily because new diseases are constantly emerging and old ones are becoming resistant to currently used drugs because of selection pressure caused by the use of those drugs. There are also still conditions for which we have no treatment available yet. If we go and look at how we go and separate drugs out into different classes, we have drugs that reduce fevers, drugs that reduce pains, specific drugs to treat malaria, antibiotics which inhibit bacterial growth, antiseptics which prevent the growth of bacteria needing burns, cuts and wounds, and mood stabilizers, so things like lithium and Valium. Penicillin is a group of antibiotics derived originally from common molds known as penicillium molds. So, penicillin is an antibiotic in which the penicillin group of the drug affects the bacteria. It fights the bacteria in your body. It is used to treat many different types of infections caused by bacteria, such as ear infections, for instance. Penicillium mold naturally produces the antibiotic penicillium. Over time, scientists learn how to grow penicillium mold in deep fermentation tanks by adding a kind of sugar and other ingredients. Some side effects of using penicillin, so the most common side effect to reactions of oral penicillin are nausea, vomiting, diarrhea. There are other hypersensitivity reactions reported in the skin and other epithelial tissues. So the way that an antibiotic works are that antibiotics will affect cell membranes as the bacteria try and divide when they are reproducing. So DTX are a range or a small range of drugs that are used in chemotherapy. So it is a chemotherapy medicine used to treat a number of types of cancers. So this includes breast cancer, head or neck cancer, stomach cancer, prostate cancer, and non-small cell lung cancer. The most common adverse reactions across all types of this drug can range from hypersensitivity, so that's hypersensitivity to light and such forth. It can cause nausea, it can cause anorexia, there can be nail disorders, fluid retention, vomiting. There's a wide range of side effects that can happen. So if somebody was taking this drug, you need to weigh up the benefits against the range of side effects. Aspirin, also known as acetyl salicylic acid, is a medication used to reduce pain, fever or inflammation. Specific inflammatory conditions which aspirin is used to treat include Kawasaki disease, pericarditis and rheumatic fever. Aspirin given shortly after heart attacks also decreases the risk of death. So aspirin is used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold and headaches. It might also be used to reduce swelling in some conditions such as arthritis. So, Prialt, so this is a non-narcotic that binds to the N-type calcium channels in the spinal cord according to results from animal tissue studies. This prevents pain signals from reaching the brain. So this drug is still in its development stage. So it relies on a process in which it goes and it blocks the calcium ion channels which allow calcium ions to enter the nerve cells. If calcium ions cannot enter the nerve cells, then a nerve impulse or a nerve impulse of sufficient strength cannot be generated within that nerve cell. So Vancomycin is an antibiotic used to treat a number of bacterial infections. It is recommended intravenously as a treatment for complicated skin infections, bloodstream infections, and bone and joint infections, and meningitis caused by MRSA. So, like we've said, it is an antibiotic indicated for the treatment of serious or severe infections. It is considered as almost a drug of last use when nothing else works. So it works by binding to polypeptides within or that make up the cross bridges that form within bacterial cell walls. If these cross bridges cannot form, then the bacteria cannot replicate. Digoxin, sold under the brand name Lanoxin, among others, is a medication used to treat various heart conditions. Most frequently, it is used for arterial fibrillation, arterial flutter, and heart failure. It can be taken by the mouth or by injection into a vein. If you have heart disease, Digoxin medication helps your heart work better to send blood through your body. It strengthens the heart muscles contractions and slows your heart rate down. It belongs in a class of medications called cardiac glycosides. It works by affecting certain minerals, so it stops the sodium potassium pumps working within the heart cells. Pharmacogenetics is the study of how people respond differently to the drug therapy based upon their genetic makeup or genes. Diet, overall health, and environment also have significant influence on medication response, but none are stronger indicators of how you will progress with medication than your genetics. Pharmacogenetics is a field of research that studies how a person's genes affect how he or she will respond to the drug in a long-term basis, or when we are wanting to go and look at the dosage of a drug that a person should be given. Synthetic biology is a field of science that involves redesigning organisms for useful purposes, such as engineering them to have new abilities. Synthetic biology researchers and companies around the world are harnessing the power of nature to solve problems in medicine, manufacturing, and agriculture. Genetic engineering is the direct modification of genes of an organism which results in capabilities being added or taken away to that organism. Synthetic biology aims to modify the behaviours of an organism or integrate behaviours to multiple organisms into a singular whole. Thanks for watching.